Fat transfers have been a large part of my practice since the early 2000s. I started performing fat transfers for post mastectomy breast reconstruction. So I performed a DIP free flap to the large number of patients I saw for breast reconstruction after mastectomy. So the DIP free flap is taking abdominal tissue, transferring it to the chest. However, the three-dimensional shape of that tissue is not conical like a breast or sloped like a breast, so you have to create that with fat. So we would harvest fat from the areas of the inner outer thighs, abdomen, flank area, or the love handle, and we would transfer this to the layer over the breast reconstruction. So think in the upper two-thirds of the chest, that's where you can add the most volume. So think of the nipple level up to the collarbone or the clavicle. That is the area that occupies the most space, and therefore we can put the most fat in that area. If you look at the nipple complex and draw a line horizontally across it, and then look below it to the fold, that's a much smaller area, maybe a third of the space. So we would concentrate on filling these areas in quadrants. We would use different modalities to identify areas of need, physical examination, sometimes computer animation, and this would help us further augment these areas. So from the early 2000s, I was performing fat transfers for post-mastectomy breast reconstruction and to a smaller degree for breast augmentation. So as we fast forward now and we're doing these for both uh, post explant procedures and for natural augmentation, which is really what we want to discuss right now. When we're going to take fat and transfer it for just a holistic mommy makeover, if you will, where we take fat from the abdomen, inner outer thighs, and love handles and other areas, we're trying to harvest enough fat to therefore transfer and create a very natural holistic transformation of both the breast and the body. So that contouring improves the hip waist ratio as well as allows for us to go ahead and develop a more naturally enhanced breast. Now, fat cannot augment a breast like an implant. So there should be no confusion. So on profile or from the side, fat will not press the breast out. So you should never think that's going to happen. That is augmentation with an implant. Now, implants can only be compressed so far and then they stop. So fat, because it's natural, it's more compressible. And plus, you put fat beneath the skin above the breast tissue. So in a natural augmentation, we don't want to put fat into the breast. That'll create cysts and cause problems with mammograms and potentially abnormalities on physical examination by the patient and by anybody who is a provider examining their breast tissue. So we want the fat to go beneath the skin of the chest, but above the breast tissue. That's the fatty layer. We have a fatty layer all over the body, and that's the area where fat belongs. So fat is your natural material. It's your own DNA. It will not be rejected. So what are the, risks and benefits of doing that? The risks are relatively low, provided a number of things have been optimized for the patient. So we run uh, the SHARP method. And so SHARP looks at basically a lot of holistic characteristics of a patient. So the holistic characteristics we're looking at are personally, how do you detox? And that's a function of your genetics. It's also a function of your diet. So we look at food sensitivities. It's a function of your hormone balance. So we look at those things. We don't want to have somebody who has really, really suppressed sex hormone levels or adrenal fatigue to undergo this without some optimization. We also look at gut health. We also, feel strongly that healing the gut, improving diet by decreasing things that promote inflammation. Things that promote inflammation in the diet are like gluten and things that are more sugar or processed. So we eliminate processed foods, we eliminate gluten. We like you to use grass-fed butter or ghee as your dairy and eliminate other dairy products. So really, we want to optimize you as much as possible. And when we do, and when we feel like that is going to contribute the most in terms of healing. So I think of it this way. So if we increase our quality of protein intake, our quality of fat intake and reduce our quantity of carbs, especially sugars, then we optimize each and every patient for each and every surgical result. And that's what the SHARP method is about. That's why our supplementation is created to optimize genetic performance with detox, to support hormonal health, gut health, improve the quality of protein in the diet. um, all these things are meant to optimize the situation so that a fat transfer should have both the, ability to be performed from a technical standpoint, both, harvesting, processing, re-injecting, but then having the patient optimized beforehand will help us get them better results.